We know that the significant determinants for poor cancer survival are behavior and dietary risks. 1/3 of deaths are due to high body mass index, low fruit and vegetable intake, lack of physical activities, tobacco, 22%, and alcohol use. And of course, as I mentioned before, late stage presentation. So these are not issues that we can tackle in a hospital setting. By the time the patient gets to hospital, the person gets to hospital, it is way too late to talk about these things. We need to address them in a community setting, and especially not just in the community clinical setting, but in a community in a non-confrontational setting, in a non-confrontational manner, where people are relaxed and willing and open to listen. So that's where I introduce our program that we're launching today, the Beauty and Health Program, which will look at seeing us look at cancer beyond the clinical setting. We want to work together with multiple stakeholders to cover all communities by reaching out to Malaysians in an innovative approach outside of a health setting environment. This program is a collaboration with Asia Cancer Forum Japan, which will see us taking this tough topic to the hearts of Malaysians through friendly stylists at barbershops and beauty salons. So, all of us go to barbershops and beauty salons. I've been going to my salon, I think, for the last 30 years. My daughter has, from the day she was born, has only gone to that same beauty salon to get her hair cut, to play on the floor while I'm getting my hair cut or my nails manicured, etc., etc. So it's just not a place that you go and cut your hair. We all know that. It's a place where you can relax. It's a place where you meet other friends, that you see all the time. And it's a place where you get beautiful hair, like today, which is not what you usually see on me, as most of my team will tell you. So it is that relaxing place that we look for, that we're willing to put our guard down, and that we're willing to chat to people about things that we find a little bit sensitive, things that we might not talk about in a dinner party, or talk about in places of formality. So that's why the beauty salon and the barbershops are so important, not just for the physical aspect of cutting your hair, but for a greater community need. So, for that, we are thankful that Astellas saw the value and importance of this program and will be graciously supporting us on this journey forward. Thank you, Angelique and Astellas. And it is also my sincere hope that the program will help us further strengthen the already close friendship and economic cooperation between Japan and Malaysia. Lastly, I would like to thank YB Kyrie, who will be with us soon, for his kind presence. I know he's had to juggle a few things to be here today, to officiate the launch of Beauty and Health Program. So thank you all.
Thank you so much, Dr. Sound. Changing health behaviors can be an absolute challenge, and knowing the strategies to uncover them is an immunity. Now, it is my pleasure to invite Dr. Muralidharan, Managing Director of National Cancer Society of Malaysia, to deliver his speech on those strategies.
Good afternoon, Salam Sejahtera. Thank you very much, Ms. Chairperson. A warm welcome and good afternoon, His Excellency, Mr. Miyasaka Tomoyuki-sama, First Secretary of the Embassy of Japan in Malaysia, Dr. Soundari Somasundram, President, National Cancer Society of Malaysia, Dr. Nori Kawahara, Representative Director, Asia Cancer Forum, Mr. Tepe Sakano, Director, Asia Cancer Forum Japan, Ms. Angelique Louise, Senior Director, Access to Health Sustainability, Astellas US, Mr. Kaljaksa Khalil, President of the Hairdressing Skills Development Association, and Mr. Sri Sudhakar, Director, Malaysian Indian Hairstylist Empowerment. Ladies and gentlemen, colleagues, members of the media, thank you very much for joining us on this very interesting and innovative afternoon. It's still a little warm though. What is this? Anyway, so I'm here just to speak to you about, because a lot of people are wondering, why are we having this health program, and we seem to have a lot of non-health people in this room, including actually a lot of our colleagues from the industry of beauty salons and barbershops. And basically, what we know is we've always stuck with health as being something that you look at within the medical kind of landscape. We have been tied to treat health as something that you deal with when you go to a clinic or when you go to a hospital, or really when you only look to do something pertaining to your health when you fall ill or somebody else falls ill near you. But in actuality, we know that health comes from how you behave or how you don't behave to do something. No one can predict who gets cancer. It's a difficult thing. But what we can predict is what people do which may predispose them to get cancer. For example, it's your kind of behavioral choice to smoke, or your kind of behavioral choice to not exercise, for example. And we know that underpinning at the foundation of everything which governs how we live our lives as humans is behavior. And what actually drives behavior? There's so many things. There's economic factors. There's personal factors like age, occupation, lifestyle. There's a lot of psychological factors and cultural and social factors. And all these different factors have little to do with hospital setting. It has got almost nothing to do with clinical setting. But it's these factors which kind of influence your behavior in everything we do every day, including health. So we have to start moving beyond the mindset of dealing with health when people fall ill. And YB Minister will tell you the same thing as well. His famous quote now is, and you will hear it, I suppose, today, is that this is a ministry of health care, not a ministry of sick care. So we try to take up the same kind of ideology as well, where if we want to change behavior so that people remain healthy and do not fall sick, we cannot wait until they come to clinics. We cannot wait until people come to hospitals. We have to go to them in their normal life settings. We have to go to where they eat. We have to go to where they play. We have to go to where they do their beauty activities. We have to go to where they go to in everyday settings. And that's really what this kind of behavioral change intervention that we look at doing with the Beauty and Health program. Can I get the next slide? So when you talk about people, this is something to do with health-seeking behavior. Why does someone go and either find a doctor, or why does someone do something which kind of encourages them to do an activity that is health promoting, something that's healthy? A couple of reasons, among which is, main is this. You have to feel that you are at risk. You have to feel that this disease is very dangerous to me. And you have to feel that by doing this activity, this preventive activity, I'm going to be safe. I give you a very classic example of Chadwick. And you all know who this guy is from Marvel. He was diagnosed with colorectal cancer. Just the fact that he lived and died with colorectal cancer, the amount of colorectal cancer screening in the US jumped by a few thousand%. The reason is now everybody saw this young, very fit, a lot of six packs and all good guy get cancer and subsequently die from it, it immediately got them thinking that I'm at risk too. Cancer is something dangerous, and I can do something about it to prevent me from getting cancer. But if you notice, the story is a Marvel story which you got from watching the movie in theater or Netflix or something. Nothing to do with clinics, nothing to do with hospitals. So what we know is, if we want to help to drive behavior change, we have to move outside the medical clinical settings. And really today is the first step we take to do that. We try to get to our colleagues within the beauty salon industry, the barber shop industry, to look at, because you all actually, for me, much more intimate with patients than doctors ever will be. We see patients when they are ill. In fact, patients will avoid coming to a doctor until they are almost super ill. Going to collapse, then only you reach a doctor. But like it or not, every month you will go to cut your hair. Like it or not, every month you will visit and have this, as Dr. Soundari was telling just now, this very strong relationship with the people who work with you in a very daily community setting. And these are the people that we hope through this program will help us in changing minds, changing hearts, changing the health of all Malaysians. So this is exactly how we're going to get across to this program. So more to come as the program develops over years and years. But today, just to tell you, why are we torturing ourselves and sitting here? Because it's all about getting you all to help all Malaysians change their behavior. That's it. Thank you.
Thank you so much, Dr. Murali. Next, I would like to invite Dr. Nuri Kawahara, Representative Director of Asia Cancer Forum ACF, to present the overview of the beauty program in other settings.
Good afternoon, everyone. I truly appreciate the opportunity to speak here today. I am Noria Kawahara, and I am Representative Director of the Asian Cancer Forum. As the person who proposed the project, I would like to provide a brief overview of the aim of the beauty project. Before that, however, I would like to say how deeply honored I am to be able to stand here in the landmark 40th anniversary year of the Look East policy. Uh, 40 years ago, just around the time that the Look East policy was being launched, I was a student at Waseda University. It was during my student days that I worked at the Japanese partner organization of ASCOJA, or the ASEAN Council of Japan Alumni. After World War II, Malaysia continued to cherish and nurture the links between the international students that had begun in wartime. Many of these former students became active leaders and worked to support and further develop bilateral ties. It was these people that I first came to hear about when I was working as a student at ASCOJA. And now I realize just how much the thought and action of our predecessors in both countries laid the foundation for the precious relationship we enjoy today. To overcome the horrors and tragedy of that terrible war and join together in solidarity, Asia has faced many difficulties and challenges. The calligraphy shown in the center of this slide was written by Mr. Nichijun Tanaka, a Buddhist monk who continued to pray that Japan and Malay people could live together in harmony. It was his determination to never give up on Asian solidarity that encouraged me in my work. No person can ever escape the past. We can only keep on living within the confines of our geographical and blood ties. Cancer is a disease that develops over a long period of time and is strongly influenced by genetic factors and lifestyle habit. Cancer, therefore, casts a long and dark shadow over people's life and cultures. Cancer is a disease reminds us of the connection we have with our loved ones and the unique bonds we share that are unique to Asia. Both war and cancer have the same effect in that they uproot people's lives. The activity of the Asia Cancer Forum are based on this recognition as we work to overcome together the shared ordeal of cancer. We have engaged in activities across Asia as a part of this unending quest. The article from Nature shown here is about the Nanjing Conference, which was held in 2007 with the support of former Prime Minister Shinzo Abe, who was so suddenly assassinated last month. It was very pity. The Nanjing Conference led directly to the start of the JICA activities in rural village in China, and it is those activities that are the origins of this new beauty program. As you know, beauty stands for bringing education and understanding to you, while infection disease keep people apart. The challenge and hardship caused by cancer brings people together. We are seeking to design cancer control measures in our daily lives so that they become more human-centered. In our activities in the rural village of northern China, I got a strong sense of how positive reinforcement and optimism have the power to change people's lifestyle and habit for the better. I firmly believe that social implementation activities using the power of beauty could also support sustainability. What is important is to provide value to people at the best possible timing with the best possible contents and the best suitable communication methods. To understand the pain point in people's individual situation and the self-realization they want to achieve, it is important to have frequent, regular contact with the people you want to help. Barber shop and beauty salon are undoubtedly one of the best positioned places of interaction for maintaining such regular and frequent contact in the community. In order to provide digital support, it will be important to implement a number of feasibility studies. These studies will aim to get to know about the changes in people's awareness, knowledge, and behavior. This information can then be used to create ideas for more finely tuned communication intervention support program. We are fortunate to have Mr. Teppei Sakano of ALM in the beauty program participating as a director of the Asian Cancer Forum. Mr. Sakano shares the same hopes and goals as the beauty program and already active in Malaysia. Working together with Mr. Sakano, we aim to create a new public-private social platform using ICT so that we can achieve UHC for cancer and ensure that no one is left behind. Finally, I would like to mention that the activity of the Asian Cancer Forum have been implemented over the years with the support and guidance of Dr. Hideyuki Akaza, who suddenly passed away on December 1st last year. As a globally recognized urologist, Dr. Akaza recognized that the work of Astellas firm as a provider of medicines has a potential to improve value and support humankind around the world. The cross-boundary cancer studies lecture series at the Tokyo University was made possible by a donation from Astellas and implemented under the guide of Dr. Akaza. It has now been continued 12 years, and the theme for this year's lecture series is UHC for Cancer in Malaysia. As a foundation for policy-related research on UHC, the lecture series is scheduled to continue in parallel with this beauty program. Taking up the baton from Dr. Akaza is Professor Shigeto Sonoda, who is engaged in comparative sociologist of changing Asia with me. With the support of UICC ARO, we will take the cross-boundary cancer studies series forward, and we will continue to engage in discussions on sustainability with the Astellas team. In just a few days from now, August 15th will mark the anniversary of the end of World War II in Asia and the Pacific. In the changing and worrying times we currently face, we must never forget that the reason we stand here today is thanks to the combined experience, effort, and hardship of President. I sincerely hope that through this beauty program, we can always join hands and hearts together to realize UHC for cancer in Asia and to ensure that no one is left behind. Thank you very much.
Thank you so much, Dr. Nori. Next, we will be having a video presentation from Mr. Teppei Sakano, Director of Asian Cancer Forum ACF, to elaborate more on the beauty program in other settings as well.
This is Sakano. new member of Asia Cancer Forum, I will be in charge of technologies of the beauty project. Thank you so much for this opportunity, and I look forward for the collaboration and how we can contribute to Malaysia healthcare market. Social app beauty will be in the center, data managing and the communication and engagement to each individual. We will be providing content such as self-checks, interface for data collection such as health checkup results, screening focusing on cancers to motivate to people to visit hospitals in the case of high-risk conditions. As a beauty project, we will be localizing and implementing 3 smartphone apps. These are most widely used apps in Japan for telemedicine, regional networks, data exchange between clinics, hospitals, and caregiving facilities, and rehabilitation practitioners, and health management and personal health record. To briefly go over each app, this is John, a telemedicine app. Yes, I understand there might be online telemedicine services in Malaysia already, but this is different. This is an app focusing on regional network, data exchange between large hospitals, clinics, among professionals and non-professionals. It fully integrated with each. This is an app, MySOS, providing each individual patient for free, taking care of daily health management to emergency care. Telemedicine can be provided by professionals based on the data extracted from hospital network connected with Join. Another app, Team, provided to caregivers, nurses, home visiting doctors, and rehabilitation practitioners. In daily data provided to for medical treatment. Yes, we need to take multiple approach as a beauty project, digitally and socially. We need to study, plan, take actions, modify, optimize our strategy continuously. This is not a one-day project. So we need to bring our heads together. We need to collaborate. We strongly believe that business collaboration and the partnership, both from public and private sector, are the keys to success. Thank you so much.
US LLC to deliver her keynote address.
Good afternoon, everyone. It is a great honor to be here with all of you today to honor the important work the National Cancer Society Malaysia and Asia Cancer Forum Japan are doing together. It has been my great honor and privilege to work with both teams for almost a year now, as they have been working on creation of this project. And we're looking forward to this relationship growing and changing. We look forward to speaking with all of you and seeing this program grow in the community, our society, and our business. It is sincerely understood that the decisions we make today have an impact on the lives and future around the world. A report from the WHO and the World Bank finds more than half of the world's population is unable to access essential health services. We are answering the clear call for assistance. Astellas has placed increased focus on our sustainability efforts to help improve access to health for global patients. In fact, doing our engagement in sustainability has become one of our 4 strategic goals. Astellas focuses on sustainability as you, providing help where it is needed most to make a positive impact on people's lives for maximum societal impact. This is our strategy and belief as we work to address the profound access to health barriers that remain for many people who have difficulty accessing the healthcare they need due to challenges such as the lack of available treatments, health system challenges, and insufficient healthcare information, which is why programs such as this are so important to us. Astellas has identified 4 areas where we can leverage our strengths and technologies to help improve access to health for enhanced sustainability of society. These are creating innovation, enhancing availability, strengthening the healthcare system, and improving health literacy. To accomplish these improvements, Astellas has made investments in research and development in recent years. In cancer, our largest disease area of focus, we strive every day to bring options for hard-to-treat cancer types with cutting-edge science and a breakthrough pipeline. We are also advancing relationships built on trust with external partners and local governments to help guide us in these efforts. Astellas stands with the community in the face of cancer's complexities, thinking creatively and searching for better ways to help. Again, just like this program. As I said, we're extremely proud to have provided support to the National Cancer Society Malaysia in partnership with Asia Cancer Forum Japan in its comprehensive efforts to improve access to quality cancer care. This support intends to help the National Cancer Society Malaysia and Asia Cancer Forum Japan reach more than 1 million Malaysian residents with cancer control efforts that include the development of a cancer educational database repository, cancer preventative registry, and community engagement sessions. This work should stimulate important discussions on cancer awareness within local communities. This support is particularly special as one of our 4 initial donations made since the launch of our 2021 corporate strategy. We hope it makes a meaningful contribution to improving health literacy in an area where it is urgently needed. We thank the National Cancer Society and Asia Cancer Forum Japan for your partnership, and we look forward to learning more about the impact of this important educational work underway to help Malaysian communities. Thank you.
Thank you, Ms. Angelique. Now let's have a video presentation from Dr. Tetsuo Noda, the Director of Union for International Cancer Control Asia Regional Office, UICCARO.
My name is Tetsuo Noda. I'm serving as the chairman of UICC Japan. UICC, or Union for International Cancer Control, is the oldest and largest cancer fighting organization. And the UICC Japan is a Japanese committee for UICC. It gives me a great pleasure to offer my congratulations to you all at the launch of this new and innovative Beauty and Health project. Led by the National Cancer Society of Malaysia and the Asia Cancer Forum, which is a member organization of UICC Japan. This new 3-year project relating to cancer screening and cancer control is a bold and interesting new initiative. I'd like to express my respect to all the people bringing this project successfully to this starting point. This community-based, digitally driven project aims to improve cancer-specific health knowledge among a wide sector of the population, which will help to improve access to knowledge and information about cancer. Ensuring that no one is left behind by improving access to medical care is a key component of universal health coverage, UHC, and for many years, UICC Asia Regional Office, or UICC-ARO, has been working to promote research initiatives looking for the realization of UHC for cancer in Asia. It is therefore truly encouraging that this community-based beauty and health project has been designed and launched in Asia. USCCR has supported the seminar series at the University of Tokyo for a number of years. This year, the graduate school students consider the issues of UHC for cancer care in Malaysia, looking at issues and challenges from multiple angles and thinking about how to improve the provision of UHC. As a director of USCCARO, I gave a lecture in the seminar series, and Dr. Muralidharan Munisan of National Cancer Society of Malaysia also participated. Dr. Muralidharan has also kindly agreed to take part in a symposium on the topic of sustainability, which will be hosted by USCCARO in coming October. In a world that is increasingly connected by digital technologies, it is very exciting to see how these technologies can help us to enhance our knowledge about cancer and also encourage people to receive cancer screening. At USCCARO, we will be watching your activities with great interest. And I'm sure that during the 3-year project, many significant outcomes will be achieved. Given that this project should bring together friends and colleagues from Japan and Malaysia, it is also significant that it is being launched in the 40th anniversary year of the Look East policy. To conclude, let me once again wish you all every success in your endeavor over the next 3 years. Thank you.
Thank you, Doctor. Next, we shall have Professor Jeff Dunn, President-elect of Union for International Cancer Control, to deliver his remarks on the program virtually.
Friends and colleagues, Jeff Dunn is my name, and it is my privilege to serve as the President-elect for the Union for International Cancer Control. And on behalf of the UICC, right up front, can I acknowledge the participation today of our ambassador and our ministers and our distinguished guests, the leadership from the National Cancer Society of Malaysia and the Asia Cancer Forum. And ladies and gentlemen, what an exciting day this is as we come together for the launch of Beauty and Health, bringing education and understanding to you and health in Malaysia. And this program, it brings together 4 key elements for cancer control, for lasting change in our communities towards a cancer-free future. The latest evidence about what we know works in public health and cancer control. Technology, embracing a digital approach, new technologies and applying them to these problems that we face. About community, making sure that our response to cancer is embedded in communities, engaged communities where we can mobilise and work together to bring about positive change. And finally, collaboration, because cancer control on a global scale requires collaboration. We need to work together, to share, to learn from each other. And this project is an example of all 4 of those elements. Congratulations to all involved, the National Cancer Society of Malaysia, to the Asian Cancer Forum, and of course, our industry partner, Astellas Pharma, who have funded this initiative and are making a difference by their participation. We all know that cancer control around the world needs us to work closely together. And from a UICC perspective, it's warming, heartwarming to see 2 long-standing organisations, committed organisations to our work, coming together, and all the individuals that work within them. Again, to the National Cancer Society of Malaysia, to the Asian Cancer Forum, to Astellas Pharma, thank you for bringing us beauty and health in Malaysia. A community-driven digital intervention, which works in and with communities to bring about positive change in cancer control. On behalf of the UICC, to each and every one of you, Thank you for your participation. Thank you for your support. I wish you all a terrific launch event, and we do look forward to hearing of the program's success as it rolls out throughout Malaysia. Again, congratulations to all involved. Enjoy the event.
Thank you so much, Professor. Now let's hear the keynote address from His Excellency Takahashi Katsuhiko, the Ambassador of Japan to Malaysia.
Yang berbahagia, Hairi Jamaluddin, Minister of Health, Dato Dr. Sanfari Somasundaram, President of National Cancer Society Malaysia, Dr. Norie Kawahara, Representative Director of Asia Cancer Forum, Tuan Tuan dan Puan Puan, distinguished guests, ladies and gentlemen. I would like to extend my heartfelt congratulations for the launch of the Beauty and Health Program. As I cannot be with you due to my schedule, please allow me to send you this recorded message. Cancer is one of the major non-communicable diseases and the second leading cause of death in the world, with the number of patients and deaths increasing every year. Early detection of cancer, early treatment, and the development of effective treatments are becoming more important for whole society to work on. In this regard, the program to be launched this time to raise cancer awareness in the community, build a cancer prevention registry, and develop a cancer education database is a very important initiative, and I wish it a great success. In Japan, one of the latest examples of our domestic measures related to cancer is the Cancer Genomic Medicine Initiative launched in 2017. This initiative includes the development of a system that enables comprehensive search for cancer-related genes to support the determination of a treatment plan suitable for each cancer patient. Also, the Center for Cancer Genomics and Advanced Therapy, CCAT, was established under this initiative to centrally manage cancer genome data and accelerate the progress of cancer treatment with integrated data. International cooperation is also essential in the fight against cancer. The Beauty and Health Project is the latest initiative between Japan and Malaysia, and it is worth mentioning that our two countries are already collaborating on cancer control measures, such as through the Asia Clinical Trials Network for Cancer Project, or ATLAS Project, led by the National Cancer Center of Japan. NCC of Japan is actively working to implement cancer genomic medicine and develop drugs for rare cancers with hospitals and centers in Asia, including Malaysia. I hope to see further development in this field. Nowadays, R&D, manufacturing, and marketing of pharmaceuticals have become increasingly globalized. Therefore, it is essential for regulatory authorities in each country to cooperate and collaborate with each other in their activities. Asia, in particular, has become an important region in recent years as a hub for clinical development and the manufacturing of pharmaceuticals. From this perspective, I am pleased to hear that Japan's Pharmaceuticals and Medical Devices Agency, PMDA, and Malaysia's National Pharmaceutical Regulatory Agency, NPRA, successfully held the second joint Japan-Malaysia Symposium on Pharmaceutical Regulations last month, following the first symposium in 2015. I wish that our two countries continue to deepen the mutual cooperation and understanding in the area of pharmaceutical regulations and development. Ladies and gentlemen, I have another reason to highlight joint efforts between Japan and Malaysia. This year is the 40th anniversary of the Look East policy, or LEP. The LEP in the past 40 years contributed to develop human resources for the development of domestic industry in Malaysia. And I hope that LEP from now on should expand its scope and be developed to include cooperation in wider areas. Health sector is one of them. Today's launch can be regarded as a good example of new partnership under the LEP. We also pay attention to the statement of Malaysian Foreign Minister Datuk Seri Saifuddin Abdullah the other day, mentioning health diplomacy as a priority for Malaysia. Japan has a lot of expertise in the health sector to offer to Malaysia. This is not limited to cancer treatment, but includes measures for an aging society and universal health coverage. I hope that Japan-Malaysia relations will be further strengthened through exchange of expertise in the health sector and provide support to Malaysia's health diplomacy. Let me conclude my remarks by wishing once again this program to achieve a great success. Thank you very much. ありがとうございます。and テレビカシ。
Thank you, Ambassador. Next, we will have Dr. Murali to tell us more about the program.
Good afternoon all, once again. So I've been asked to give a little project brief and to tell you how Beauty in Health is actually going to be running over this is a 3-year program. So it will actually involve quite an intensive participation of actually a lot of our colleagues across different sectors. And I want to talk to you about how this program is actually going to kind of be materialized and work and its impact felt across Malaysia. So we're dividing the project into 3 big phases. And in phase 1, we're actually first working, and this is an ongoing process already. We are actually working with different groups of Malaysians, because as I think Dr. Sundari alluded to earlier, and which you all already are aware, Malaysians have come in different colors and in different shapes and different sizes as well. And along with this, we have our very different tastes. So some of us will go to, for example, Malaysia Kini for news, and we will watch YouTube. But some others, and unfortunately, I'm in the group that is now we call elderly generation. Because from our recent research, for example, we were engaging people to find out what is their channel of communication. And that's really part of the first phase, is to figure out where do people get their health messages from? Who are the people that connect to you best about health? And to my utter shame and of course shock and horror, I was very excited. I have a Facebook account. I have an Instagram account which I use from time to time, but I do not use TikTok. I don't know how to activate TikTok. And we ran one of the focus groups for young people from the age of 20 to 30. And I'll tell you the exact quote of the person who we asked, like, oh, so you all are using Facebook as your major source to get health news. The person just laughed, and you know what they said? Doctor, Facebook is for old people. So, and then I said, then I asked whether, oh, do you get your news from Instagram? I said, Instagram is for not so old people. So, what is the group that actually what does these young people do? And not so young. I mean, I consider 20 to 30 not so young. 20 to 30, your primary source of any kind of news is TikTok. So where do you watch news is TikTok, the channel for CNN, but the one that comes on TikTok. It's news, the Star, but the channel that comes on TikTok. So so as part of the research, we actually we show them like the Star website They're like, oh, start a website. So in the first phase of this entire beauty and health project, we're going to spend quite a bit of time in which we engage with different groups of Malaysians from different ages to actually find out where and how they actually receive their health information. First kind of objective. Also in phase 1, what we are then trying to do is run a buffet line. What do I mean by a buffet line? As you know, and this is again a very Malaysian trait. I don't know whether our colleagues from Japan who are always, I lived and worked in Japan for about a year, and I know they're extremely health conscious. We are quite lousy. So in Malaysia, when you go to a buffet, which all of us do, especially during Ramadan, and all the other festivals associated around it, what you do is you won't go and pick up 4 things. You will go and taste everything from the 520 things there, a bit. So that's exactly what we're trying to do with the second part of phase 1, in which we are running a taster menu, a buffet line, which we are working with these different groups of Malaysians and trying to find out what are actually their tastes. Do they like celebrities to come and give them health messages? Do they like, I don't know, Kim Kardashian to tell them, look, start exercising every day? Or the Kim Kardashian Malaysian equivalent, whoever it is. Or is it that we should get them to kind of get their health messaging from their parents or their friends or their girlfriends? So these are the kind of mediums that we are trying to look to explore in terms of doing health messaging. But at the same time, this project was going to involve a very interesting and unique concept called change agents. So this again is nothing new. It comes from, I hate to use the word, MLM. Okay, as you know, we all know, because we face MLM colleagues or family members who are into MLM every day. Multi-level marketing. Right? MLM salesmen are the best salesmen in the universe. You actually will go to meet them and you don't want to buy anything, but somehow they'll sign you up for a monthly plan. MLM and insurance agent are the best salesmen in the world. So, and what we now realize is, in order to convince people to sell them a product, which is health, we need to use the same strategies or techniques as MLM sales. So what we try to do is, we intend to work with our colleagues in the beauty industry, in the barber shops and in the beauty salons, to kind of change them into becoming change agents, for them to be able to sell, I use the word sell, but they are not selling, they are promoting some sort of health behavior, right? For all these different customers. In fact, we had a joke where we were telling the barber and the beauty salon, not so much, beauty salon as well, but barber is the most powerful individual in control of someone's life. Because when an MLM salesman sells you something or sells you a product, they will bring you to tea or coffee, and then, oh, why don't you have tea? Or why don't you have coffee? And then that time I will tell you the product. But with a barber, you have a very distinct advantage. I will talk to you about the product when I have a knife to your throat. So you cannot run away, right? And of course, my female colleagues tell me it's actually even worse. Because for a girl, once they give their hair, they surrender their hair to the stylist, they're at their mercy. If you don't want to listen to what I say, I will give you a horrible haircut. Sometimes it's worse than that. Anyway, I'm kidding. But so that's the idea of why we want to use these change agents who we know work with everybody in the community every single day. So we hope to be able to upskill them. What do I mean by upskilling? Giving them a little bit of training so that they can kind of sell the idea or sell the product. So also in phase 1, what we are looking to do is start developing training module, a program to be able to train our colleagues in the beauty salons, in the barber shops, to be then able to give this kind of information to their members to their clients. Now, with this kind of phase 1 comes to a kind of end. In phase 2, what we hope to do is build something called a cancer preventive portal. And we have very, very good partners with the Malaysian government, as well as with our colleagues from organizations in Japan, who will help us to build this portal that will enable every single Malaysian to have relevant health information for them in their own taste, in their own style, in something which is a manner that they like to have. And that's kind of what the second phase of this project will do. What the portal will also give you is the ability for you to get prompted. Hello, Murali, you are 40 years old now. You need to get your colorectal cancer examination in July. So there will be a feed that will pop up on your own personal kind of space or account, and that will tell you when are the tests that you should go for, where you can get these tests, and most importantly, how to also keep those results that you have. Again, very sorry to not criticize our Malaysian community, but just to share with our colleagues, Malaysians have this horrible habit of shopping. We shop for everything. If we can find a wife, we will tell you, can I get the wife cheaper for 5 ringgit? So it's the similar with healthcare. We shop to find doctors. Sometimes I have patients who move 8 doctors, 9 doctors before they will reach someone who they want to get treatment from. And the problem with shopping and moving doctors is actually very, very simple. When you move from one doctor to the other, very often 2 things happen. One, your health information, whatever your 120 tests that you've done with this doctor, when you go to the second doctor, you can't move the information. So what does the second doctor do? Start doing all the 120 tests all over again. So it's a delay of time as well as a waste of money. So in order to be able to migrate your health information very quickly, we are trying to make sure that that preventive portal also enables you to to store your own health results. So my cancer tests and all that, I can store that. And most importantly, I can download when I move from doctor to doctor and show them. So it's already, by doing that, I will again save time, which is really of essence when somebody may or may not have cancer, and money, which every Malaysian likes to save every day. It's part of our way of life. So that's the kind of second phase of this entire program. And in addition, what we're also trying to do, and subsequently in phase 3, is when this project will grow into a nationwide kind of initiative, is we hope to be at that time able to, 1, make sure that a lot more of our colleagues in industry, more and more barbershops and beauty salons will actually start joining in, and be able to push out this information to Malaysians as a whole. We intend to also work together with our colleagues and partners in the Ministry of Health Malaysia to be able to complement their screening and health promotion services and ramp it up on a national scale at the same time. So why and how come, which I think some of our colleagues may have mentioned over the course of the afternoon, is why are we working with Asia Cancer Forum? Simply because of this. Asia Cancer Forum are the first people, Kawahara Sensei and her team are the original people who conceived of the beauty project and ran a very successful project utilizing the same space, the same group of people, the same kind of interventions in different countries, including in China. So what we're doing is, again, a very Malaysian thing. We know something works. We want to copy, cut, and paste. And what we want to do, and again, something very Malaysian, we'll add some sambal to it. So, and that's the whole idea of us kind of working with ACF because they're the technical experts who've done this successfully in a different setting. And we want to try to bring this to Malaysia, cut, copy, paste it, and Malaysianize it. And other than ACF, we are very fortunate to be able to work with many different Malaysian partners who are experts in this area. For example, the University of Malaya, who is Prof. Victor and some other colleagues are here today. They are perhaps, as you know, one of our leading universities, and Prof. Victor and various other colleagues from University of Malaya will lend their kind of academic expertise to the collaboration as well. Also, from an academic perspective, we have colleagues from University Kebangsaan Malaysia, the National University of Malaysia, and UPSI, University Perguruan or University Pendidikan, Sultan Idris, Prof. Samsia and their team, and all these different academicians are going to bring different kind of expertise to this whole concept and process of behavior change as we go along. Now, even though we're looking at this entire project as something outside healthcare, at the end of the day, it is essentially something about health. So we cannot ever separate this from the front line people who every day deal with healthcare in this country, which is the Ministry of Health Malaysia. And which is why our key partners in working at this project include the Ministry of Health Malaysia at various levels, from our Ministry of Health Central in Putrajaya, people like Dr. Faisal's team, and also people from clinical institutions, including Hospital Kuala Lumpur, various other hospitals, and we'll also be joined by experts from the Institute of Health Behavior Research from the Ministry of Health Malaysia. So, and of course, all these kind of minds, thoughts, ideas that we're putting into the program will never ever be successful without our hands and feet who are actually on the ground giving the intervention, which is why we have with us today as well some very prominent individuals as well as representatives of various beauty salon and barber shop kind of organizations, including the Hairdressing Skills Development Association and the Malaysian Indian Hairstylist Empowerment Organization. So we thank our colleagues, and we're also for being here. Thank you so much for coming up for the studies, which is not really kind of something very different, not something that you're used to, but also for our colleagues who are with other chains who are also working in this area who have joined us today. So we are hoping that it's all these different stakeholders coming together that will actually enable us to bring up something that can change behavior. I go back to our most favorite dish in Malaysia. Again, arguable, everybody has their own kind of version of it. Nasi lemak. So, and if you've seen, the nasi lemak is our favorite dish, which comes from a combination of many different cultures, many different ideas, many different heritages. And together, it makes this absolutely brilliant dish, which is more or less arguably our national dish in Malaysia. So on a very similar footing and idea, we hope that beauty and health will have all the different condiments so that we can together make it a healthy nasi lemak, which will give a lot of benefit to all Malaysians all throughout. So welcome all of you, our colleagues to Malaysia who joined us for the first time, and to all our colleagues in Malaysia. We look forward to getting this up, going, and helping more Malaysians as and when we come along. So thank you very much, and I think my advertising session sudah habis kerana we are very fortunate to have Prime Minister with us now. I will kindly request if you could stand and welcome.
Thank you, Dr. Murali. Now, let us all welcome Yang Berhormat Puan Khairi Jamaluddin, Minister of Health Malaysia to the floor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam keluarga Malaysia, sihat sejahtera. Datuk Dr. Sontri Somasundaram, President of the National Cancer Society of Malaysia, Mr. Miyazaki Tomoyuki, First Secretary, Embassy of Japan, Malaysia, Ms. Angelique Luis, Senior Director, Access to Health and Sustainability, Astellas US. Ladies and gentlemen, first of all, it's always a pleasure to be together with the National Cancer Society of Malaysia, ally, friend of the Malaysian Ministry of Health. I'd like to thank NCSM for inviting me to this launch of Beauty, bringing education and understanding to you and health, which is a collaboration between NCSM and the Asia Cancer Forum of Japan. I'd also like to thank the Asian Cancer Forum of Japan, as well as the Embassy of Japan for collaborating in this interesting initiative. We're in year 3 now, 2 years plus of the pandemic, and as you all know, we have transitioned towards a new normal, some form of transition towards a form of endemicity, I suppose. But it's still there. The pandemic is still there, and it's still not safe for everyone. And that's what I always drive home in our plans to mitigate the danger of COVID-19 to the public. We have to understand that it is, by and large, for many people, a disease that you can recover from, especially if you're vaccinated and if you have access and qualify for antiviral treatments. But for some categories of people, it's still a deadly disease. And that's something that we need to continue to stress as far as public health mitigation is concerned. One particular group, of course, who are still at high risk are cancer patients. Because of their health condition, because of the condition of their immune systems. So it's very important for us to continue to manage the pandemic. And I know that many people don't want to hear about COVID anymore, but for some people, it is still about life and death. So it's very important that while we allow for most people to continue their lives as it was almost pre-pandemic, but for the highest risk or those who are at highest risk, we continue to protect them with public health measures, with access to booster doses, and with access towards antivirals. I'm sure all of you here know that every year, about 50,000 people in Malaysia are diagnosed with cancer. We expect this to rise to almost 70,000 people by 2030. Preliminary analysis done by the National Cancer Registry has shown that, of course, the most common forms of cancer in Malaysia, breast cancer, colorectal cancer, lung cancer. These are the 3 top types of cancers in Malaysia. At the Ministry of Health, of course, we try to do our best to put in place public health programs that can reduce the worst outcomes of cancer. One, of course, is through better screening. And we have introduced the PECA B40 program under our company, Protect Health Corporation, And we partnered together with private general practitioner clinics to allow for members of the B40 community access to screenings for breast and prostate cancer and other NCDs. At our public clinics across the country, we provide breast, cervix, and colorectal cancer screening across the nation. But we still need and welcome all kinds of support from NGOs, private sector, individuals, especially to get the public to be aware of early detection for cancer. One of the problems that we're facing is that we are providing free screening, comprehensive screening for the public, especially for those from the B40 community. The problem we're facing is to try to get them to the screening. That's proving to be a huge challenge for us. Out of 6 million people in Malaysia that qualify for the PKB40 screening program that we have run for the last 3 years, only 600,000 have come forward for their screening. And that's 10% of those who qualify for free screening. And increasingly, we've asked for our partners, the private general practitioner clinics, to even go out to the community to do screening in the community rather than wait for people to come to the clinics, to make it easier. I did one in my constituency recently. We targeted about 500. We only got about 200. And that's even with line listings of names, addresses, and also phone numbers of people for us to call up and invite them personally to come for the screenings. And I think part of it has to do with cultural norms in the country, where for many people in Malaysia, it's still something that is not, they feel is not necessary. They feel that they seem healthy, they look healthy, and therefore they must be healthy. And perhaps there is a fear of finding out that they are suffering from something. So this is very, very important that we change the worldview of Malaysians to understand that screening is not something that is going to give you bad news, but something that can be used to prepare, detect early, and identify health issues earlier for them so that we have better outcomes in the future. And we have to be able to change the worldview from one that is almost fatalistic to one that's more proactive about looking after one's health, and not just regarding Ministry of Health as the ministry for sick care, but actually looking at the Ministry for Healthcare and well-being, keeping people healthy and preventing people from falling sick. That's why the program today is very timely. Many of us here enjoy our visits to salons, and of course, these visits to the salons and to the barbershop is not just something necessary, but also a form of relaxation for most of us. We share stories with our stylists, with our barbers, about what we do in our lives. And for stylists, for instance, to share educational cancer-related information is certainly very interesting. Using different people as means of communications to share cancer screening and prevention information is a significant effort to ensure that important life-saving knowledge is being shared with people who otherwise may never hear it. So I applaud the ingenuity that is being proposed here. And I think we should normalize talking about it, not in morbid terms, of course, but just something as innocuous and innocent as when was the last time you went for a health check? Isn't it nice to know that we are in good health? And I think that's something that can nudge people into thinking, yeah, I've not been for a health check in a while. I better go, and I better find out what's happening with my body. I've always felt that community empowerment is key to the success of any policy, not just in health, but of course across the board. Societal involvement is significant in ensuring that our policies and practices can reach everyone. Involving the community in cancer awareness is a surefire way to improve cancer literacy and public awareness about the importance of screening. Early detection makes all the difference, and I think you will have heard this from NCMS, from cancer survivors, from cancer patients, that early detection really is a significant factor in improved outcomes as far as cancer patients are concerned. In the spirit of empowering the community, the Ministry of Health we have many community health volunteers. We have COSPEN, which is the Community Sehat Pembina Negara, consisting of community volunteers coming together to fight NCDs via community-based interventions. We're targeting about 250 of these community-based volunteer groups to conduct colorectal screening using the IFOBT, the fecal occult blood test, yearly for colorectal cancer. And all eligible volunteers in these localities will be screened by a self-test, and the results will be sent to our district health officers for further evaluation and management. So these volunteers are going to be at the forefront, promoting screening to other members of the community. I often find that when you're trying to push a message about health and public health, it helps when your peers are talking to you about it. It helps when people in the community are talking to you about it. Nobody wants to listen to the Minister of Health. So it's better that we empower people in the community to share information, knowledge about screening, intervention, outcomes, so that it's something that empowers the community. You feel that your behavior will change when you listen to somebody who you trust in the community speaking to you about it. Ladies and gentlemen, of course, this program, this innovative program is being supported by the Asia Cancer Forum, facilitated by the Embassy of Japan. This year is the 40th anniversary of the Look East policy between Malaysia and Japan. Not only have we enjoyed more than 65 years of diplomatic relations, we've shared in sustainable, efficient development models that has helped both nations flourish. And I'd like to thank our partners from Japan for sponsoring this innovative program. I'm encouraged to see organizations like the NCSM, the Asian Cancer Forum Japan, discussing, cooperating such pertinent topics such as cancer outreach. And congratulations to you once again. And thank you on another note to NCSM, in particular Dr. Murali, who was really at the forefront of this. We achieved something quite significant a couple of weeks ago, which is the second reading of the Smoking and Tobacco Control Bill in Parliament, which we hope will become law in the October session of Parliament later. And this is so important because we know for a fact now the science is absolutely incontrovertible and clear as far as smoking being a cause of cancer, being a leading cause of lung cancer, and it's something that we should just stop, full stop. So thank you very much to NCSM, keep up the fight, and hopefully in October we cross the line. So once again, thank you to everyone here today, and it is my hope that the Beauty Project will continue to educate and help save as many lives as possible. Thank you. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Wendy, for the speech. Please remain on the stage for the launch. Let's also invite Dr. Sound, Mr. Mia Saka, Mrs. Angelique, and Dr. Marie to launch the Beauty and Health program. To officiate the launch, kindly place your hands on the plasma ball. Kindly please place your hands on the plasma ball.
our launch. Oh, and my recording is good.